The first leadership award that we will present today is the SMDM Career Achievement Award. This award recognizes distinguished senior investigators who have made a significant contribution to the field of medical decision-making. This year's recipient is Doug Coyle. Doug joins an illustrious list of previous career achievement winners. Doug, the floor is yours.
Thanks so much, Jeff. It's great to receive the award today, and I'm extremely grateful for receiving it, especially from yourself. This means so very, very much to me. In the context of this award, I'd like to first describe how my career has developed. I'm the youngest of 3 children raised by a single mother earning less than minimum wage, living in a social housing apartment in Scotland. I grew up at probably the optimal time for someone with my background. University was free and a subsistence grant was provided. I was one of the many who were the first generation of their families to go on to higher education. After completing my undergraduate degree at Edinburgh, my master's in health economics at the University of York was the catalyst to my career. The small size of the class gave me ample opportunity to interact with incredibly talented faculty, and I slowly realized I could develop a career in academic research. After graduation, I worked with Mike Drummond until 1995. I made the move to Ottawa. Economic evaluation has been the perfect focus for my career. The geekiness component gives me immeasurable joy, and the underlying principles have more than satisfied my desire to do work of value. Health economics is based on the principle that the health of all of the population matters, not just those directly affected by a specific disease or intervention. The goal is not to manage a budget, but to maximize the health of the population we serve. Health economists, we know, are often subject to criticism, frequently from those with a vested interest in undermining the healthcare system. Changing our nomenclature to emphasize the underlying social objective of our work may be helpful. My thesis work under the supervision of Martin Buxton and Bernie O'Brien has provided a theoretical paradigm for my work relating to methodology, practical applications, development of guidance, and providing advice to policymakers. I try to ensure that the focus of my work remains not on complexity for complexity's sake, but accurately measuring the long-term health benefits and costs of new interventions. I'd like now to briefly comment on a current issue that concerns me. We live in a society deeply torn apart due to the rise of extremism, especially on the far right. Such developments are not unexplainable. If we look closely, we can see that they have arisen due to an increasing sense of desperation for those growing up in hard financial circumstances. As I progressed through my own undergraduate degree, I saw firsthand how many of the programs and benefits designed to improve social mobility were eroded away by the Conservative government of the time. Now all I can see are the incredible obstacles in place for someone who grows up in similar circumstances to myself, limiting the access to the opportunities that I have benefited greatly from. This has led many to distrust those in power and sense anything that cannot be worse than their current situation. Academia needs to be truly representative of society at large. We need greater representation from those who might be considered on the margins. Be certain that the research we do is of relevance to them. I'm immensely grateful for the career I've had and still enjoy so much. I'd now like to say thanks to the many who have contributed to my development that I have not yet mentioned. To all my colleagues and graduate students over the years in Ottawa, teaching and supervision are the best time to demonstrate your passion for what you do and inspire the future generation of researchers. To my many health economics colleagues who have enjoyed collaborating with so closely, especially Mike, Petrus, and Lauren, my HEAC buddies, and my friends within the Convoy Network. A special thank you to Karen Lee, Director of Health Economics at Cardiff. I'm sure you don't want to be reminded that we have worked together now for over 25 years, and I'm so proud about how your career has progressed. To my five kids, Anna, Gemma, Lucy, Amy, and Aidan, thanks for keeping me grounded at all time. And finally, the biggest thank you goes to my wonder wife, Catherine. Your constant support by giving me the self-confidence to believe in myself, both in my work and as a person. Being able to collaborate so closely in our work and enjoy your smile during every work day makes the career I have chosen so complete. You make me strive to be a better person, and this award is very much a joint effort. Thank you all.